Hi, this is Dr. Mohammed. My wife has suggested that I do this. This needs to be on the record because she needs to have credit later on. First thing I'm going to talk about today, or for this video, is what is a herniated disc. Most of my patients, they come in and they have herniated disc and I have to explain what it is. I'm going to start talking about herniated disc and I'm going to talk specifically about in your lower back. When we talk about the lower back, if we look at this chart over here, I'm talking about these areas right over here. This is one of the areas that gets herniated most often. We also have a lot of herniations in the cervical area, which is this part, but today we'll talk mostly about this. Now when we talk about herniated discs, it goes by several names. Sometimes they'll say herniated disc, a bulging disc, a slip disc, some people might even say a pinched nerve. We're always talking about essentially the same thing. These areas over here, these are your vertebrae. Each of these vertebrae, they're made up of bone. And in between the bone, we need some sort of shock absorber, which is the disc right over here. The disc, it gives us several things. First of all, it's a shock absorber and allows for mobility. And it keeps the proper spacing because in between each of these vertebrae, there is a nerve that comes out. So if this disc is not doing its job properly, this nerve is going to end up being compressed by the vertebra, or if the disc is bulged, the bulging itself will put pressure on the nerves. Now when you have pressure on these nerves, this is when you have pain going down your back, going down your legs, and it feels generally like a sharp, burning, tingling type of sensation. And when you think of a disc, if you think of it almost like a balloon, if you take that balloon and you squeeze it, it's going to bulge out. If you take this disc and you squeeze in the abnormal position, it's going to bulge out. If it bulges towards the nerve, that's when you have that pain, that shooting pain going down your legs. And that's why some people might refer to it as a slip disc. The way I treat it is a very straightforward, simple, effective way of treating it. This disc is having too much pressure put upon it. Essentially what I'm going to do, I'm going to be sure the spine is lined up very straight. And I'm going to take the pressure off of the disc by essentially putting traction or distraction, separating the spine. I separate the spine, I cause the disc to go back into place, and we allow the disc to heal. Now it's not, when I take the pressure off the disc, that is one part of it, but we also have to move that disc. We have to kind of pump the disc, because the disc is what is known as avascular. That means it does not have a vascular system. The only way the disc gets any nutrients that it is allowed to heal is through motion. So I have to put motion in the disc. I have to put motion in the disc, a kind of more of a pumping action, so the nutrients get in, so the disc is allowed to heal. If I just separate it or cause a traction without putting motion into there, it's going to be very difficult to heal because there's no nutrients going in and no waste getting out. If you have any questions, please leave a message and I will get back to you.